Given a choice, most medical professionals would prefer to provide a truly healing alternative to their patients, rather than treatments and drugs which tend to mask the pain and don't effectively deal with the root cause.
The current alternatives for pain, and we're not even talking about healing, but just to reduce pain, are either temporary or dangerous.
That's why so many clinicians are excited about 830 laser therapy and the new opportunities it presents.
One of the first patients we tried on about a 10-year history of knee pain, and we manipulated his low back, treated his low back, back's feeling fine. And he mentioned his knee had been bothered, so well, let's try it on his knee. After about a 12-minute session, he stands up, and this is what most patients are doing. They look perplexed, they look confused, and they're sitting there just testing the knee, and there's no pain.
The patented 830 laser produces a unique laser light that is capable of passing through human skin, blood, water, and fat without being absorbed. As it penetrates up to 2 inches down through the subcutaneous tissues, an incredible biostimulation takes place.
Essentially, this is the device. It harnesses a technology called biostimulation, and what it does, and you can see these are diodes. This gallium aluminum arsenide diodes. The photons that's generated that come through this diode have the ability to pass through human tissue, skin, blood, water, fat, and it has the ability to go down 2 inches into human tissue because it doesn't get readily absorbed by the skin, and as a result it's able to penetrate deeper. Now once those photons reach that depth, all the cells in that path are biostimulated, and what that means is it's the ATP production is increased, the lymphatic system's stimulated so it can remove the debris and cellular waste products out of that region. It creates a better environment for the cells so that it can do 3 things really. It can repair faster, it can regenerate and rejuvenate the cells, and with that you get decreased pain, you get increased tissue healing.
About a month ago I took some time off to remodel a rental home that I have, and I developed this pain in my back, low back, and my back end and down my legs. And I'm sure it was from bending down and crawling around the floor and working. And it got so I couldn't sleep at night. I'd just ache, and I decided I'm going to have to go to a chiropractor, a doctor or something. And then my wife, she just got a cold laser, and she thought maybe, it was the middle of the night, she said, let me try it. So she tried it on one side. And so the next day when I went back to work, and I didn't even think any more about it, and then I realized in the afternoon that the pain was gone on that side. It no longer bothered me. So that night she'd worked on my other leg, and that was about 2 weeks ago, and the pain is completely gone. I was having a problem even driving. I couldn't even hardly stand to sit down in a seat. But with 2 weeks has gone by now, and it's still feeling good.
In many cases, the patient experiences significant improvement immediately.
I pulled a hamstring and it popped pretty bad, and I was pretty crippled up. I had done this about a year ago and was debilitated for maybe 2 months, almost couldn't hardly walk. So I was kind of upset that it happened again in practice. That re-aggravated it. My experience was I had the treatment for 20 minutes, 2 sessions. The next morning, I was 2 hours into my day before I realized that my hamstring didn't even hurt. I didn't even notice it. That feels totally back to normal to me. I'm exercising again, lifting weights, wrestling with the kids in our program, and jogging, everything activity that I had done before.
Recently, the Olympic Training Committee approved the use of the 830 laser on all Olympic athletes. And even consecutive Super Bowl champions, the New England Patriots, attribute the ml830 as a factor in their success.
If you've tried physical therapy, chiropractics, if you've tried epidural injections, if you've tried steroids, and it's still not responding, I would say absolutely try the 830 laser, because that's the kind of people we're getting at our open free clinics, our complimentary clinics. We're getting people like that, and they're walking out, they're saying on their testimonies that it works.
As success of the 830 laser spreads, patients with carpal tunnel, arthritis, muscle, and joint pain problems are requesting this therapy as the treatment of choice for its safe, effective, and fast-acting properties.
I've gotten to a point now where I don't get surprised anymore with the results. I still get excited because it's real live people who are experiencing pretty tremendous things, but it doesn't surprise me anymore. Because of the phenomenal results we've been getting and the testimonials we've been getting from clinicians and patients alike, we believe that this will be a household name very shortly within the next couple years.
Currently, a special incentive plan offered only to clinicians makes it possible for them to realize a quick return on their initial investment. Physical therapists, chiropractors, physicians, nurses, veterinarians, and even dentists are recognizing the power of the 830 laser.
Pericoronitis, third molar wisdom tooth impacted with a lot of swelling and a lot of pain, and she couldn't even open her mouth. So I treated her with a laser about 10 minutes. The pain was gone. I am having really good experience with this.
Besides being safe and easy to use, the 830 laser can provide an excellent return on investment and qualifies for a tax deduction as an essential equipment purchase for most practitioners.
When clinicians take 20, 30 minutes out of their busy schedules to listen, to hear about this and really look into it and do some research, they absolutely get excited. I think probably 90% of all clinicians that I've personally spoke to about this want it.
Visit www.830laser.com today or ask your 830 Laser representative to find out more about 830 laser therapy.